Welcome. The purpose of this video is to provide training on the EasyMax long-term care blood glucose system. This video is intended for facilities where point-of-care testing is conducted by a healthcare professional. In addition to this video, please thoroughly read the EasyMax LTC long-term care manual, user's manual, and all product instructions before using this system. You'll find the EasyMax LTC blood glucose system provides consistent, accurate readings and is easy to use because it does not require any calibration, and that means less steps for you. The EasyMax LTC system consists of the EasyMax LTC monitor, EasyMax 15 test strips, EasyMax 15 control solution level 1 and level 2, user's manual, and the LTC long-term care manual. Let's get started setting the time and date. Turn on the meter by holding down the center power button. Hold down the right button for 2 seconds until set displays on the screen. The last 2 digits of the year will begin to flash. Use the left and right buttons to set the year, and then press the power button to confirm the setting. Repeat steps to set the date and time. You will then be prompted to turn the medical record function on or off. When the medical record function is on, you will be able to keep testing records for multiple users by assigning each user a number from 1 to 999. I'm going to demonstrate the meter today with the medical record function on. With the display set, you are now ready to use the meter. There is no calibration or coding required with the EasyMax LTC. When you open a new vial of test strips, check the expiration date to make sure that they are not out of date. Make sure you write down the date that you first opened the test strips on the space provided on the vial. Test strips are good for 6 months once opened, or until the expiration date, whichever comes first. You are now ready to perform your control solution test. There are 2 levels of control solution, level 1 and level 2. For the purpose of this video, we will be performing the level 1 control solution test. Once opened, the control solution is good for 90 days. Be sure to write the date opened on the bottle's label. Now let's take a closer look at the test strip. The white angle tip is for blood application or control solution. The other end has 5 black bars called electrodes. Now position the test strip with the electrodes facing up and insert the arrow facing the meter into the meter's test strip port. The meter will automatically turn on. If you have the medical record function turned on, the number in the right-hand corner of the screen will flash. In this case, I will flag the result as a control solution test, so it does not matter which medical record number I select. Once I select a medical record number, the Apply Blood icon will appear in the display. Press the left arrow button once to select the control solution mode. You will see the control solution icon appear in the bottom left of the screen. This means your result will be flagged as a control solution test. Now take the control solution and rock it back and forth several times before each use. Remove the cap, wipe with a tissue, and apply 1 drop of control solution to the top of the cap. Touch the drop to the blood collection area at the tip of the test strip. Once the control solution has been detected, the meter will count down from 5 seconds. After 5 seconds, the level 1 control solution result will appear for you to review and record. The meter will also store this result in its memory as a control solution test. Compare your result with the range listed on the test strip file. There is a range listed for level 1, level 2, and level 3 control solutions. Record the required information according to your institution's guidelines. If your control is out of range, follow your institution's guidelines accordingly. Repeat the same procedure using the level 2 control solution and record the required information. You are now ready to perform a glucose test. Clean your resident's hand with soap and warm water, or use an alcohol wipe and then dry completely. You should wait at least 5 seconds until the intended area is dry and clean before sampling the blood. Use a new test strip and insert it in the test strip port. Be sure to close the test strip bottle right away and make sure it is securely closed. The medical record number will begin to flash. Use the left and right arrows to select and the power button to set each digit. If you do not select a medical record number and you have the medical record function on, the result will record as medical record number 000. The Apply Blood icon will now appear in the display. Obtain a drop of blood following your institution's lancing or blood collection policy. With the Apply Blood icon flashing, touch the drop of blood to the tip of the test strip. You may now move your resident's finger away from the test strip. You will see the blood being sipped into the test strip and the test will begin. The monitor will beep once blood has entered the strip's reaction zone. A 5-second countdown will begin. After 5 seconds, the blood glucose result will appear for you to review and record. The meter will also store this result in its memory with the assigned medical record number. With the meter facing down towards the appropriate trash receptacle, push the strip ejector on the top of the meter to dispose of the test strip. Never use a test strip more than once. Do not bend, cut, or twist the test strips. Your meter stores a maximum of 480 test results with the time, date, and medical record number of each test. By pressing the right or left arrow button, you can review them at any time. When the memory is full, the oldest result is dropped as the newest is added, so it is very important to have the correct time and date set in the meter. We recommend that you wear gloves when cleaning your meter. You should also wash your hands after taking off the gloves. Contact with blood presents a potential infection risk. We strongly suggest cleaning and disinfecting the meter between patients. To disinfect the meter, dilute 1 milliliter of household bleach, 5 to 6% sodium hypochlorite solution, in 9 milliliters of water to achieve a 1 to 10 dilution, where the final concentration of 0.5 to 0.6% sodium hypochlorite. You may also use any EPA-approved disinfectant product that meets the 1 to 10 bleach solution. Wipe the surface of the glucose meter, including the test strip port and USB port after each use. Be careful to make sure no liquid goes into either port. Wipe the meter thoroughly. The treated surface must remain visibly wet for a full 2 minutes to attain complete disinfection. If you have any questions or any difficulty operating the EasyMax LTC blood glucose system, reference the instruction manual that comes with the meter or call EasyMax customer service line toll-free at 866-994-3600. 3345 Monday through Friday, 8 a.m. to 6 p.m. Eastern Standard Time. Thank you for watching this video and for using the EasyMax Long-Term Care System.